Black Doctors Podcast.
Hello and welcome back to the show. I'm excited to jump into today's episode. It features Dr. Anthony Douglas. He is a general surgery resident that I had the privilege of working with as a critical care fellow. I am posting this episode just a couple of hours late. Usually I get episodes up every Sunday night, so they're ready for download Monday morning. However, I just came off of my first week on service in the ICU, so it was a little busy and a little behind the power curve, but here is today's episode. I'm excited to share. We've been growing exponentially since starting up season 8. If you haven't already, follow us on Instagram at the Black Doctors Podcast, or follow my Instagram as well at Stephen Bradley MD. And we're going to continue to kind of expand the show and the different services and perks that we offer. Life's going to be pretty busy for the next couple of months. I am studying for boards in October, but excited to bring you so many more resources and ways to grow professionally, socially, and to continue to build this community that we have here. So I'm going to jump into today's episode and then tune in next week for the second half of this episode, which really jumps further into Anthony's experience during residency. Disclaimer, the views discussed in the show are our own, not those of our employers. Hello and welcome back to Black Doctors Podcast. I am Stephen, your host. I am an anesthesiologist and ICU doctor with a passion for medical ethics and health equity. And this is the Black Doctors Podcast. So privileged to have with us the one and only Dr. Anthony Douglas. He is a general surgery resident. I was fortunate to work with him during my time in fellowship. Excellent clinician, compassionate, kind, caring physician. I can't quite read the rest of your handwriting on these accolades you want me to read, Anthony, and your check hasn't cleared yet, so I'm going to stop there. Dr. Douglas, welcome to the show.
Appreciate you for having me, Dr. Bradley.
Man, so it's been, it feels like longer. It's been a month since, pretty much I moved, well, not even a month, a couple of weeks since I moved. We've both, though, gone on to bigger and better things. And just that 12 months that we're working together, I am starting my new job as an attending. You have graduated from at least the first 2 years of general surgery residency. You are starting your research time. But before we get into that, let's share, just your backstory, I guess.
Yeah. I'm from South Bend, Indiana, originally raised by both my parents, my mom, Rachel Douglas, and father, Anthony Douglas. I was actually the first in my family to go into medicine. I'm the first to graduate college in my family. And so, but I came from a very proud family, a proud household. My father grew up really very poor as a young man. And so he, instilled the same principles of work ethic and determination that allowed him to kind of get to escape the cycle of poverty and cycle of poverty that his family grew up in. And so because of my parents, I attribute a lot of my success and where I'm at today, obviously to God, but also to my parents. Born and raised in South Bend, Indiana, went to public high school, and that's really where my passion for medicine was cultivated. My parents always encouraged us to go into something that we would always have a job. And obviously healthcare is one of those big things. My parents were a big influence on in terms of choosing this career field. But in high school, I went to a school that was a medical magnet program. So each high school had like a different thing it was specialized in, whether it was technology or baccalaureate arts and different things. And the school I went to was medicine. So we started off early, in our freshman and sophomore year, learning about medical terminology, taking anatomy courses related to medicine, in addition to our general education courses. And that kind of cultivated my passion for medicine, in addition to what my parents started. And then my junior and senior year, you get to shadow in clinics and in the hospital. And I actually, my first black doctor was a pediatrician, Dr. Jan Sanders, who obviously had an influence on me that I probably didn't know until I, came of my current age and having the wisdom I have now. But seeing her as a black physician But the first African-American doctor I shadowed was Dr. Carlton Lyons, who was an OBGYN in South Bend, Indiana. And my relationship with him became extremely impactful down the road. And when I was in college, actually, there was a point during my freshman year when I thought about, taking a different career route when I was struggling in some of the pre-medical science courses. And, a phone call with him helped me see it through for one more year. And ultimately is why I'm still here today. So,
and so you met him during high school.
I met him, my senior year of high school as was shadowing. We all got to choose like one physician that we wanted to follow. And I got paired with Dr. Lyons and had a great experience with him. My relationship with him was very impactful, and it proved to, have a huge impact later on during college when ultimately I found myself struggling and I needed some advice. And so my relationship with him is what kept me going.
Wow. And I just want to, highlight that, because I doubt, I assume he volunteered to participate in that program.
Yeah. He didn't receive anything for doing that.
And it just goes to show, as we continue on as residents, as attendings, having that ability to give back, everybody doesn't need to stay in academic medicine, but there's always going to be some way you can get involved and make an impact on someone's life. And you are here, obviously, because of his investment.
Yeah, that's really why I take, a lot of the opportunities even that we get as residents very seriously to volunteer and to interact with young people, because I know just by seeing us, our presence is impactful and powerful. And I think, you never know what influence you'll have on the young person that you're interacting with or talking to on any given day. And so, whenever I know you probably remember as a, resident, whether it was like through the Community Champions program or through whatever opportunities that come across our email, I really try to take advantage of those and try to be whatever influence I can to the next person who has a dream to be a doctor, a dream to do anything. Yeah.
Yeah, man. I remember I hit you up for brunch or something one weekend. You're like, "Oh, I gotta teach the youth." I'm like, "Man." Hit the Michael Jordan meme, but I was like, let me let this man be great. So no, that's a beautiful story. Where did you go for college and what did you study?
I went to Wabash College for undergrad, which is a small, actually an all-male liberal arts school in central Indiana. I studied psychology. I majored in psychology, minored in biology and chemistry, which is, I think, is most undergraduate students, either they're not told or just don't know that, you don't have to major in any like biology or chemistry in order to go to medical school. You just have to take the prerequisites for the MCAT and the prerequisites of the school that you're applying to. So I think that's a pretty good hack. I wasn't really interested in like biology and chemistry. Actually, I find that a lot of the students who applied to medical school, that necessarily wasn't their like interest, was the hardcore biology, plants and animals and the chemistry, but they had a passion for learning about human anatomy and human physiology and pairing that with service to humanity. So majoring in psychology allowed me to study something that I was actually like really into and interested in, while also still preparing for medical school.
Yeah, and along the way, being first generation college student, first generation medical school applicant, how did you know what steps you needed to take to apply for medical school?
Yeah, I mean, a lot of it was mentorship, really, having mentors in my life that helped guide me along the way. Also, my choice of college was really important. So I think when you're looking at schools at that age, as you're going from high school to college, I was like focused on going to a big school like the Ohio States or the, Indiana universities, like large state schools. And unfortunately, a lot of those schools don't necessarily have the resources to dedicate to individual students to help them along their journey, right? And you really are a number during that time in college. And so going to Wabash College was pretty huge for me, where I got kind of that individual attention. I told them I was interested in medical school, and just by that, doors opened for me to like prepare me for medical school. I had an advisor who knew I was interested in becoming a doctor, so she had the information about like, these are the courses you need to take, and this is how we'll set up your schedule so that you can take these courses and that you're not overloaded. And so choosing a school that I felt like I had those resources was really important for me to be realistic in terms of getting to medical school. Also, having access to my professors was a big deal. Like being in those courses, that being in biology and chemistry and all those courses where at a big state school, you might not have that individual attention, or you might not be able to actually meet your professor. At the school I chose, I was able to go to their office hours. I was able to have that one-on-one attention when I was struggling in the course. And then lastly, in college, we had a pre-medical advisor. So for the students who, were trying to set up an application and trying to get through the MCAT and do all these steps in order to get to medical school, we had somebody whose job, Jill Rogers was her name, who was dedicated to helping us get to medical school successfully. So I think a lot of it comes down to choosing a school that has the resources to help students who say, I'm interested in medical school, get there.
No, that's huge. Sounds like you hit all the right steps, and you had that path. You reached out and people helped you along the way. Mm-hmm. You went to IU for medical school?
Yeah, I went to Indiana University for medical school.
And when you started medical school, were you planning on becoming a surgeon?
No, I wasn't. So being a first generation college graduate and having no one in my family that was interested in medicine, I honestly didn't know what. I didn't even know there was I didn't know residency existed. So I was in medical, not medical school, in graduating college. I was like, oh wait, there's training after medical school. Like, this is crazy. So, and then when I started medical school, I didn't even know all the different residencies that existed.
Yeah.
Right. Like, I didn't know that you could do general surgery. I didn't know that there was plastic surgery. I didn't know that there was internal medicine, and internal medicine led to infectious disease, cardiology, gastroenterology. Like, I didn't know any of those things. And so when, during my first year of medical school, I knew that I wanted to serve people who looked like me, and be in a field where, I could care for the people who look like me, as well as I liked emergency medicine. So not emergency medicine as a field, but I liked being in emergencies where I had to take care of somebody in a very acute setting. And so I didn't truly know what field that was, which is trauma and acute care surgery. I didn't know that was a field in and of itself until I was finishing my second year of medical school. I was like, this is the kind of doctor I want to be.
I had a very similar situation. I mean, I went to Howard. My parents went to college, but I was the first one in medicine. So my goal that I worked so hard for was to get into medical school. Yeah. And like you can kind of mention, once I got there, I was like, okay, I don't know what's next. At the end of the first semester, I cleaned out my locker and was planning on, like, in my head, I was like, I'm going to go home and like probably not come back. I probably would have sat on my couch and like came right back the next semester, but I was, in my feelings and but I didn't know what came next. I thought I wanted to do orthopedic. I was like, I want to be an orthopedic surgeon because I was a pre-physical therapy major and I had shadowed an orthopedic surgeon. So that's the only thing I knew. So I showed up to Howard and I'm like, I want to do orthopedic surgery. And then I looked at all the other people that wanted to do orthopedic surgery and they were like miles ahead of where I was. And I was like, I don't want to do orthopedic surgery. And then I was lost. There were specialties that I found out about when I was like on my way to residency, like urology or ENT. ENT I never was exposed to and didn't really think of it as even an option. So it's huge and it's tough as a first generation or somebody. Like, these are questions that feel dumb to ask. Like, if I was sit down and ask, like, well, what's the specialty? Like, I didn't feel comfortable asking, even in like the amazing environment that Howard was. So it's great that, through social media, through this podcast, there's people that, hopefully could provide some representation or examples of what type of physician people can be.
Can we double tap on that story about how you almost didn't come back? Because I don't think I even know this one. Were you struggling academically, or what was it?
No, I was good. Academically, I was fine. I was just lost. I didn't know what I was doing next. I didn't know what specialty to go into. I rarely really set goals for myself, but that was like the one goal I had was medical school. And once I achieved that, I was just kind of lost and floundering. But I had some, two of my classmates that were like, I was going to walk to the train station, Shaw Howard train station with all my stuff in my locker. And they were like, oh, let us drop you off. And they like refused to let me walk because I was going to like just be in my feelings the whole time. And they literally forced me to I think we ended up on U Street and probably at Alero with the mango frozen margaritas. And then everything was much better. And I went home for Christmas break and then came back, and the rest was history. But it was just the incredible impact that those friends had at that exact moment of time when I needed them to kind of pull me out of the dumps. But yeah, man, we're here. We made it.
Yeah, we made it.
So you found surgery, as you're doing your rotations.
I do recall there, Dr. Rutland. He's actually a trauma surgeon, and Dr. Rutland actually came to our campus and gave like a talk. I don't remember what it was about, but I remember he was a trauma surgeon. I remember how he made me feel in that conversation, and just when I met him and he talked about what he did. That's kind of the moment I knew. I was like, this is what I want to be, and this is who I want to be like. And so, I feel like a lot of people have those moments, but it was just, seeing people who look like us is so important. Again, in terms of our journey, because it ultimately influences a lot. When it influences us to continue going, but also influences sometimes your career as well. So I think it was I started my third year rotation off doing research. So we all get an elective during medical school, and I took mine as the first month to do research. I started by emailing like surgeons that were doing research on things that were interesting to me, and just let them know, hey, I'm a medical student. I have an interest in surgery, and I want to do some research. And I was wondering if you have room for like a student. And I sent a couple emails, didn't really hear back from too many people, but then I went to a surgery student interest group meeting, and they said, this is the attending who is over student research. So I emailed her the same day, and I met with her in her office probably a week or so later. And she asked me about what my interests were, what my passions were. And she ultimately became my mentor throughout the rest of my medical school education, and my PI for all my research projects. And she helped really groom me for the application process and for what applying to surgical residency looks like. She helped cultivate relationships with other surgeons within her own department and across other departments, so that I had not only, my relationship with her, but relationships with other attendings that I could, work with, whether it was with other research projects or just shadow. I started to build a reputation with not only her as like a strong medical student with a strong work ethic, but I got to develop that reputation with other surgeons as well, which is important for like letters of recommendation and all those things. So my relationship, being proactive and reaching out and finding mentorship in medical school, especially during that third and fourth year when you're starting to figure out what residency you want to go into, was ultimately what helped me be successful in terms of applying for residency.
Yeah, let's dig into that, because we're recording. It's like July. We'll probably publish this around August. But we're going to be heading into application season. What are some of the things that you think were extremely instrumental in you successfully matching into general surgery?
I think by far the most important thing for applying for general surgery residency is mentorship. And the reason I say that is because the mentorship helps all the portions of your application, right? So like having a mentor allows you to have somebody who's willing to overlook your personal statement, to give you honest and critical feedback about your personal statement, which is a big portion of the general surgery residency. I think, when it comes to personal statements during specifically general surgery residency, your personal statement either, gets like a quick second look into the dumpster, or it captures the reader's attention immediately and they become very invested and interested in who you are as a person. So I think that's definitely important. The other reason mentorship is important is for letters of recommendation, right? So not only is that mentor likely going to be a letter writer for you, but they're also going to tell you who else you need to develop a relationship with within their department or within the Department of Surgery in order to have strong letters of recommendation that and from people who are well known in their career or in their field. Also, they may be the person that introduces you to that person, right? So like that relationship with Dr. Meager allowed me to meet several different attendings that ultimately became my letter writers for places that I really wanted to go. So, they know where their colleagues trained. And if they know that you're applying to that place, they'll make sure to build that relationship with that person that knows people at the place you want to go to. I would say also like the mentorship allows you to get involved in research projects. So, research, I would say, it's important for applying for general surgery residency that you demonstrate that you have an understanding of the process of the scientific method of studying things, right? So like, you know how to ask a scientific question, you know how to create the methods to study that question, and then you know how to speak about it meaningfully. So like have a number of research projects is not very important, but having meaningful research and something that speaks to who you are and what matters to you, and that you actually like had an active role in, it definitely stands out. I was actually having this conversation not too long ago, and we were talking about a medical student who had 26 research projects in application. And I actually like that having 26 actually in some ways hurts you, right? Because now on, interview day, you have this.
Unless you got like a PhD or something, a PhD or MPH, and you've been in school for 12 years.
That's what I'm saying. You look at the application, it's like 26 projects. And
what else you been doing?
Right. And it's just, to the attending who's looking over your application, it's like you didn't really contribute meaningfully in 26 publications. It's capped, right? And so, having research, it's not necessarily important about the number, but it's about what you contributed, what you learned, and your ability to speak meaningfully about the research project that you participated in. Obviously publications help, but it's not the end all be all of applying to general surgery residency. I would say the other, the pro tip, which also again speaks to mentorship, is meeting with the program director and meeting with your chair, right? So meeting early on with your chair and telling them you have an interest in surgery, and telling them, a little bit about yourself. Bring your resume or your CV, whatever you have. You want your chair to know your name, because during general surgery residency, there's a chair letter, right? And that chair letter, that it can either sound like that person knows you or has never met you before in their life. And so you want your letter to sound like, okay, this is a chair that has met this student before. And I think that has a big impact. Meeting with your program director, they'll give you advice on what you need to do, what letters you need, what it takes for you to be successful in terms of the application process. So I think, mentorship at multiple levels is very important. Yeah. Having resident mentors, having attending mentors, the resident mentors ultimately help me be successful on clerkships, help me earn, a strong reputation with not only residents, but the attendings, because people talk in the hospital, as you know, Dr. Bradley, right. You keep talking all the
time. I'm going to catch strays on my own podcast.
But having those resident mentors is so important, because residents speak to the attendings and they speak to each other.
Yeah.
And so if you're a bad medical student, it's going to be well known. And if you're a strong medical student, it's going to be well known. So having those resident mentors that give you the advice on, listen, this is what you need to do to rock the clerkship. This is what you need to do to, stand out on the rotation. And then they can also tell you, these are the attendings you want letters from.
Right. And these are the ones who are going to actually write a letter, and these will take forever and not get back. Yeah. Yep.
Yeah, for sure. So, and then having the attending mentorship, which, like I said, was ultimately what really made me successful in the application cycle. So I hope, for the listeners, and especially the pre-med listeners and the medical student listeners, that they really take heed to some of the things I said, because ultimately that's really what helped me.
Yeah. And this is obviously on top of getting the grades and passing the exams and all that stuff. I want to dig in, though, on the mentorship, because I'm not. Tune in next week to hear the second half of this incredible episode on the Black Doctors Podcast. We're here because representation matters. If you've been listening to the show and haven't already, definitely follow us on social media. Go to iTunes or Spotify, wherever you get your podcast. Leave a ranking and a comment, and share with your friends.